Hi, we're at the conclusion of the AATS Mitral Conclave 2017. Dr. David Adams, tremendous success. You know, I mean, 2 days of just nonstop education. You know, what are your thoughts?
I'm relieved it all went so well, first of all.
I can imagine.
You know, Randy, honestly, it just, like we've talked about so many times, life's about relationships and friendships, and the room is full of people that know each other. And again, it's interesting, all the colleagues and that have trained before and all these interactions, that creates some of the energy. The other thing I think is this intense focus on one disease. I think it's impossible to come here and not leave a better mitral valve surgeon. And I think that's what we felt the last 2 days, and I'm sure you agree with me. We go to many meetings around the world, but this one has a unique sort of feel, and I'm really proud of that.
Well, you should be. I mean, it's a tremendous amount of work that you and your colleagues put this meeting on. But David, you know, we were in here, there's 1,300 plus physicians in this room when you start the meetings, these plenary, and then all the breakout sessions, and you get this, you really do get this energy and this people learning from those that have had much more experience, and then the interchange, learning from each other.
I thought that one of the most unique things we did today was we featured lots of complications, and I thought it was really interesting to see several of the most experienced surgeons in the world sharing how they got out of situations that weren't expected. And you're right, that kind of interchange is invaluable, and I think the discussion and the interaction with the audience getting up and asking questions and even talking about their own patients was one of the really special things to take away from this one.
I don't think there's any doubt about that. I mean, we were talking earlier, I wish you'd had double that audience with that being cardiologists, because they could have learned. So you also did a big focus on transcatheter therapies this year, appropriately. You know, what do you think? What do you think we learned and heard?
We learned a lot about first of all, starting to be established fields like MitraClip, which of course is really becoming very prevalent in Europe, where they have wide approval for application, and as you know, in the United States, it's being used more and more in complex high-risk degenerative disease, as well as in a trial for heart failure, which we will learn more about in the next year or two. So that obviously was a much bigger part of the meeting this year. The transapical beating heart, echo-guided beating heart repair techniques, there are two different groups now working on that. That was obviously a exciting part of the meeting, and many different abstracts and presentations in various forums about those technologies. And then finally, the TMVR, the mitral valve replacement field, that's coming. That's much more complicated and newer, but I think as we watch this meeting evolve over the next decade, I have no doubt that we'll have to probably get an extra day, because there's going to be so much more to talk about.
I mean, an extra day would be great. So let me ask you, the final thing is, I think you made a conscious effort this year, you and your colleagues on the program committee, to have a lot of cases. And I think, to me, sitting and watching, to have multiple of the experts up there watching cases, discussing it, it's a tremendous, I mean, you learn by seeing a lot of cases, and that's a great deal.
Yeah, I've always believed that the focus of this meeting should be on reconstruction and dealing with complications, and trying to present things that you may not be aware of, or that actually are uncommon. And I think this year we really found a sweet spot with that. I mean, we just had a session to conclude the meeting of really complex scenarios, and we saw operations that I don't think any of us have ever seen before. And I think it's, again, something I'm going to remember for the next conclave, because there was a lot of interest in that. And again, I think, you know, for the patients out there, presenting that stuff and all of us learning, including myself, has got to be good for the individual patient as well as the field.
Well, you did. You and your organizing committee, and then all the infrastructure did a great job. I mean, all these participants from many countries. It's great for the field, and I think it's also, as you said, great for relationships. So congratulations.
It's one of the things I think that as the American Association for Thoracic Surgery, it's one of the meetings we're really proud of, and I'm really excited about the next one.
Good. Congratulations.
Thanks, Randy.
Thank you, David.
Thank
Good.
you.